Loft 100 Studios, the Big Biz Show, and our affiliates and our hosts are not registered investment advisors or broker-dealers.
Our show hosts make no commitment that the purchase of securities of companies profiled or otherwise mentioned in our programming
are suitable or advisable for any person, or that an investment in such securities will be profitable in general.
Given the nature of the companies profiled and a lack of an active trading market for their securities, investing is highly speculative and carries a high degree of risk.
We profile selected publicly traded and privately held companies on our program.
Specific questions on comp and...
Most of these companies that we profile have provided compensation to Loft 100 Studios and its hosts for the profile coverage.
From time to time, we sell shares of the companies profiled in the open market that we receive as compensation for coverage of client companies.
But never sell stock if we are speaking about, interviewing, or covering a public company who has paid us compensation.
Specific questions.
Specific questions on compensation can be directed to producer@sullyentertainmentgroup.com.
Listeners should verify all claims and do their own due diligence before purchasing any securities mentioned on this program.
Investing in securities is speculative and carries a high degree of risk. We encourage our listeners to invest carefully and read the investor information available at the websites on the Securities and Exchange Commission, SEC at sec.gov, or the Financial Industry Regulatory Authority, FINRA, at finra.org.
Welcome aboard.
Ain't no lot to see. All those plans I made for myself, I got nobody else to lean on. Got so far with my head in the clouds, now it's time to get.
You okay? You okay? You okay, Annie? Annie, you okay? You okay? You okay, Annie?
Yeah, the next guy wasn't in the room yet.
Welcome to the Big Biz Show, featuring insight, analysis, and a lot of stuff that's none of your business.
Hold on. This is the Big Biz Show. I think it is their business.
Making the markets work for you. Here's the man with the plan, Sully.
Hey there! Live from the Loft 100 Studios in sunny San Diego, California. Big Biz Show is on the air. Great to have you along today. Sully, Costa, the day trader Quattro. Let's get right to it because there's a new word rolling around the economy called rolling recession.
Okay.
Which means that we're seeing unemployment high, stock market is reacting well. Inflation seems to be pulling back, but we're still in trouble because we're ridiculously high prices compared to pre-COVID.
All right.
Okay?
Gotcha.
So how can all this good stuff be happening over here when the economy is in a mess? Well, we're having a rolling recession, and what that means is certain sectors are being hit at different times, not all at once.
Gotcha.
So it means it won't feel as bad, but it'll be more protracted. And that was going on. And the reason why we don't like high employment during times of recession is very simple. The more we hire, the more people have jobs. The more people have jobs, the more money they have. The more money they have, the more they spend.
True.
We want to try to curb consumer spending. 70% of any economy, any GDP, gross domestic product, the report card to any economy is based on consumer spending. Consumer spending is good. But when you stimulate an economy too much like we did during COVID, we should have had one stimulus, not three.
Okay.
You got a supply chain issue over here because of the pandemic, not enough goods and services. What is inflation? Too many dollars chasing too few goods and services.
Right.
Simple as that. What happens when you have too few goods and services for a supply chain and then way more money than you ever had before? You see the disaster?
Of course.
That's what happened here. And if you want to meet the enemy, and by the way, I can't blame all the families that got 3 stimulus checks who needed them.
Right.
But we're paying the price right now. That's the problem. And that's how you have to feel about this.
Yeah.
So now you have this thing called rolling recession, meaning that things are looking up. There's light at the end of the tunnel.
Good.
We could see this thing called a soft landing. I hate that word just because it's overused, but we could see we could see it. This is going to be more prolonged than we think. It'll go through the end of the year versus, look, we shut off our economy like a light switch. It's not going to. It's going to go back on like a sunrise. You got to think in terms of that.
You see any pivot points out there?
I don't see. No, but Mike, we can course correct, buddy. Don't use soft landing, course correct, or pivot in front of me anymore.
And moist.
Because we're having a moist course correction in the economy. Worst word ever made, right? Hey, my good friend David Luci is with us. He is the president and CEO of a company called Acurx Pharmaceutical Corporation. ACXP is their stock symbol. They are a publicly traded clinical stage biopharma company that develops a new class of antibiotics. Why is this important? It's because our existing antibiotics are failing us. You've heard of people going septic. You've heard of people getting in the hospital and antibiotics. We've overused antibiotics to the point where we're in a little bit of trouble. So here to talk about that is a guy that I respect greatly, and we need to get in the studio so I can just hang out with him off the air. David Luci. David, how are you, sir?
Very good, Sully. Always good to be with you.
You look like you're getting fit, my friend. What's going on over there? Is your wife not feeding you anymore? Because
she threatened me with some sort of cheeseburger casserole tonight.
Hey, listen, don't threaten me with a cheeseburger casserole. Mike looks like a walking Hungry Man dinner with that shirt, so don't bring up food like that.
I was about to say, David, go on about that cheeseburger casserole, please.
Sully and Dinty Moore on the Big Biz Show. Or is it the brawny paper towel guy? Hey, David, I got so many emails last time you were on because we talked about the problem with existing antibiotics. And you guys are creating a new class of antibiotics. It's super important that we bring in a new class for the reasons I sort of touched on. But I'm going to let you take over from here and talk about the real problem, because it is a real problem, correct?
It is a real problem. The CDC says if we don't have significantly more classes of antibiotics by 2050, we'll be in a post-antibiotics world where a simple bacterial infection can be death.
Yeah. Just about the time we're all seniors, super seniors. Yeah. Just about the time when, we're grays on trays at that point, right?
And we'll be in hospitals.
Right, exactly.
Super.
Hence the tray, gray on tray. Honestly, about the time that we're going to be facing all those troubles is about the time. So what is the reality that companies like yours, Acurx Pharmaceuticals, can come up with this as opposed to a new generation of an existing class? Because there's a difference. We're not creating a new generation of an existing class of antibiotics. We're creating a new class of antibiotics. Explain that part.
Right. So bacteria has memories. And when I shake hands with you, the bacteria on our hands joins together, and they share memories of all the antibiotics that they've experienced from their hosts over time. So that's a process called antimicrobial resistance. And the bacteria morphs its properties more easily when it faces amoxicillin, because it's seen penicillin so many times. So it's able, the bacteria, to change its properties in order to avoid being killed. With a brand new class of antibiotics, you're all set. It lasts as max efficacy for a longer period of time.
If your phase 2B trial goes on with your existing sort of arc of your FDA story, what happens next, and when can we see the benefits of that as patients?
So if our 2B goes well, and we're very confident that it will go well, we're starting to consider early termination because the data, seemingly the blinded data we're observing, is that good. If that trial goes well, we'll simultaneously go to the FDA, design our phase 3 program with the FDA, knowing that we're a fast track designated QIDP product. So we're gonna go in aggressively and hope for a smaller phase 3 mandate. And at the same time, we're going to explore strategic alternatives with a big pharma partnership in mind to be able to cover off the sales and marketing period.
And that's kind of the risk-averse model of biopharma these days, is it not? You can either bring it to the goal line with your own handsome young men and women pulling a suitcase in the doctor's offices selling the product, or you hand it over to big pharma to get it over the goal line, and they're using their distribution model, and you're back to research, right?
Absolutely. We go back to the researchers, and we pick up these antibiotics in the drug discovery phase when it's too early for big pharma to get interested. And we bridge the gap between the researchers and their innovative products and big pharma by doing all the early stage legwork.
Dave, I want to get you back on next week because we're a little short on time this week, but I do want to talk about the C. difficile sort of malady that you guys are focusing on because a piece of it. But you know, we got to be happy and talk about what the viewers want to talk about. They wanted to talk about your brain and why it's important for a new class. David Luci, of course, ACXP is their stock symbol. Thanks, Dave. I appreciate that. And I'll tell you what, with respect to Grays on Trays, I want them to fix this well before the year 2040.
Something less to worry about.
You're shaking like a dog pooping peach seeds. I'm not freaking. I don't want to deal with. I don't want to deal with the antibiotic problem that is Mike Costa. Big Biz Show.
Mr. Peach Seed.
Thank you.